for the real reason that it actually hurts in that area, we have to understand what's happening when we are sitting, even in the good position. You sit down, we generally, especially if we're sitting on a normal chair as opposed to a kneeling chair or perching on a stool, we generally eliminate and flatten out the lordosis. Note, we are still sat on the sitting bones in this position. But what this does is it compresses and puts strain on the lower lumbar segments, L4-5 and L5-S1. As a result, if we've got any degradation of health, we've got minor disc bulges, dehydration of the discs, or herniations in that section of the lumbar spine, we are going to aggravate those tissues. And what is extremely common with injuries to the lower lumbar spine is that patients will actually point in clinic to the area of the body that they're feeling the pain, and they're actually feeling the pain over here. There is nothing that can go wrong here, short of falling off a ladder straight onto concrete onto this section of your spine, you fracture the bones. But even so, the fracture will heal relatively quickly. The disc injuries and other ligamentous injuries will be what bothers you in the long term. But you're not actually experiencing pain here. Although you feel pain here, this is very similar to sciatica, whereby we experience the sensation in the leg, but it's because there is an injury at the lower section of the lumbar spine. So what we get in this scenario is not kind of a full, true sciatica, but it's that we're getting this referral pain leaking from the L5 or L4-5 segment, L5-S1 or L4-5 segment of the lumbar spine, leaking down over this area, and it feels like it's kind of going down into the bum area. And that's why we're experiencing this pain in the sacrum and the coccyx. It is a referral of pain from those lower lumbar segments that are injured, that are then exacerbated when we are sitting down, particularly for long periods of time. Using a cushion or something else to sit on does absolutely nothing for the actual impact or load on the disc. It also does absolutely nothing for the coccyx, because the coccyx, if you've got a hole down here that you're sat on because you're sat on a cushion, your coccyx is miles away. It was miles away from the flat seat that you're using anyway. So it's not really going to make any difference. Now, granted, it might be comfortable, but it's not doing anything to take pressure off the coccyx. The additional problem with some of those cushions is that they could actually be making you a little bit worse because they're soft and squidgy, you kind of sink and flatten round the lower back even more into that position, thereby aggravating the lower back more, aggravating the pain that you're experiencing more, vis-a-vis making the feelings of soreness in your tailbone and coccyx worse.